Hey, everybody, welcome to the Nutritional Frontiers webinar. I'm so excited to have Dr. Brenda Branch with me tonight. And a lot of people don't know this, Brenda, but we've known each other for a very long time. We're from the same town, and Brenda actually started the first naturopathic clinic in our town. And at the same time, I started the first personal training. So we were like these two women, like pioneering these movements in our little town of Altoona. And I can
Mhm.
probably say, what is it, 30 years later, you're still in business and still going strong and
Still
having,
doing it,
yeah.
doing
So
what we love. Yeah.
yeah. So it's testimony that you can be successful in this industry and, serve and help a lot of people. So tonight we're
Mhm.
going to be talking about targeted detox solutions for GI dysfunction. Before we move on, I do want to remind everybody of our upcoming April training event, professional training event. If you have not signed up for that yet, please do so. You want to go to the website, nutritionalfrontiers.com under education and events and sign up for that. It's going to be an amazing time. Dr. Brenda's going to be there. I'm going to be there. We have some new team members coming in. The evolution of chronic disease is the topic. And I have to tell you, we have some awesome speakers and incredible panels. But we're going to get started on tonight's PowerPoint, and Dr. Brenda's going to take us home. So, Brenda, the stage is yours.
All right. Thanks so much. I really appreciate it. I'm just super proud of you, Tracy. I think you've come a long way and also you just have helped so many people and your education is dynamic. And I just am like honored to be with you in this journey. And I look forward to working with you in the future. And I'm loving Nutritional Frontier and all they have to offer. So thanks so much. And thanks everybody for being here. So this presentation is pretty much a culmination of 30 years of practice. I mean, I've been doing this for a long time, but I keep seeing the same thing. So it's a little bit repetitive, but working with thousands of clients dealing with gut health, dysfunction, chronic symptoms, we now can understand, this microbial imbalance, that's what we're going to try to figure out. But it definitely is a microbial imbalance that's going on. So today we're going to connect the dots, we're going to look at this microbial imbalance. We're going to look at candida or yeast overgrowth, parasites, dysbiosis. And we're just going to look at some protocols and some strategies that I have put into place, and maybe it could be helpful and it would be great for you to use for yourself or for your clients. So this is me, Brenda Branch. I'm a little fuzzy on this screen, but I'm a little clearer on that one. But naturopath, been doing this for 30 years and just, really just doing what I love, helping people one-on-one. And, there's a lot of suffering that's going on and that we just do not have enough people out there helping those people that are suffering and are looking for answers and are needing guidance and are needing help. I just think the line is long, and the people that are in need to help serve these people are, we have a great need for that. So I wish you to join us in this endeavor to really help people. So let's talk about the importance of your gut. Maybe these days we've been hearing much more about gut health, but its importance and what we should be doing, to help the gut and all the things that are attacking our system. So it's not just about digestion. We have to look at our gut as pretty much responsible for almost everything. For our immune system, 70% of the immune system function, nutrient absorption, detoxification, hormone signaling, neurological health. I mean, it's our second brain. So, serotonin production is happening in our gut. So when we think of anxiety and we think of depression, we've got to think of our gut. Cardiovascular concerns, respiratory concerns. So the importance of the gut is really something we should be looking at on a regular basis, not just when we have problems, but what's happening to us day in and day out is really an assault on our intestinal system. So the gut microbes, this is a whole microbiome. What's happening here is a whole ecosystem. So you might want to think of it like a fish tank. A lot of times I talk about the gut microbes as a fish tank, or your gut is like a fish tank. So it's a whole ecosystem that's happening there. And this ecosystem is working to, help the entire environment. So there's different levels of the ecosystem or the microbiome, the surface, all the good bacteria that's happening in there. And just everything that's happening is just really helping with the digestion, with the immune system, detoxification, metabolism. So we really want to have a healthy microbiome. We want to have a healthy fish tank. We want to have a healthy coral reef, so to speak. And when we don't, the microbiome is not balanced and we'll have more bad than good. And then what happens, our coral reef looks a little bit like it's dying. And we feel like it on the outside and we feel like it in the inside because it's really affecting our entire body. So if the gut is inflamed or compromised, what's going to happen is the immune system is constantly activated and we start seeing autoimmune disorders that are happening too. So autoimmune disorders are on the rise, and I think 80% of the autoimmune disorders are idiopathic, but that doesn't mean there isn't a root cause. It just means they don't know. And I think after we go through this today, we're going to see that we do have reasons why we may be developing autoimmune disorders, and it has to do with the gut, and it also has to do with pathogens, mycotoxins, microbes that are making their way across the border, so to speak, of our gut. Maybe we have leaky gut syndrome, and then what happens is our immune system's overwhelmed. We start getting, it starts attacking ourselves. It's confused. It's immune fatigue. We have that happening today, and it just gets worse as we go along with co-infections and other issues with the gut. I mean, pathogens of all kinds. So um this is a pretty important chart here, because we want a really healthy microbiome. We want good bacteria. We want fish in our fish tank, so to speak. We want the balance of yeast. So there is a good bacteria, fungus, or yeast level in our system. So they're in harmony, and when they're in harmony, the body functions efficiently. And when they're not and out of balance, then what happens? We move into dysbiosis. So we need to have that strong gut lining. We need the fibers of our gut or the junctures to be tight, the zonulin and oculent. We want them to be tight. We have that, we have low inflammation. So, if we don't have that, we have low bacteria or, not enough fish in our fish tank. We have too much yeast overgrowth. It's like a pearl that kind of grows beyond the border of the intestinal wall. And that's what kind of causes the gaps to widen in the small intestines. And then we develop this leaky gut. And then we have chronic inflammation. So, you don't get chronic inflammation with, illness without inflammation, and you don't get inflammation without gut involvement. So it's really important to make sure that your healthy microbiome is where it should be, and you're not developing this illness or inflammation or chronic inflammatory condition that continues a lot of times unknown until you have something, pretty serious going on. So, what are the causes of dysbiosis? This imbalance. So, a major contributor is antibiotics. So, I have tested people on my Zyto testing, and it'll come up antibiotics. So I tell them, I'm like, oh, have you been on antibiotics? They're nope. And I'm like, okay, so let's go over your diet, because then we have to look at like the foods that you're eating that contain antibiotics. Because most people are just thinking, oh, I take antibiotics. I haven't taken antibiotics. I'm fine. I like stay away from them at all costs. Well, if you're not looking at your food and analyzing that for its antibiotic content, then you probably are missing the boat. And I think, when we look at glyphosates or things like Roundup and things of that nature, back in the day when it was first marketed, it was marketed as an antibiotic. So we have to think of like, okay, well, we're eating things that are sprayed with this pesticide, herbicide, and it has acted or was like an antibiotic. We think of it as more of a pesticide, herbicide. It's killing off bugs, but it's killing our bugs. And so what happens is our good bugs, our good bacteria. I give these analogies. So, we're constantly being assaulted in our digestive system to the foods that we're eating. And it might not be just that hamburger you see there, but yeah, it could be. Sometimes it's just good food. I mean, you can have dysbiosis even if you have a really good diet. So, you know, you're doing your best, but there's a lot of things that we're up against. So, of course, sugar and processed foods definitely going to feed yeast and cause inflammation. Stress is definitely something that is a major factor when it caused by or causing dysbiosis. And when we think of stress, we're thinking about like taking on just too much. Like you can eat really good diet, you can have all the supplements in the world, but if you are stressed, you can develop leaky gut. Like the stress level will break you. So you've got to get in, you've got to get close to God. You've got to, have that personal relationship. You've got to have that stress reduction. You've got to take time out for yourself. You got to honor yourself. There's a lot of different things to take into consideration when thinking stress. Environmental toxins everywhere. I mean, I have a new facility now, which is more healthcare services, and it's because of the environmental toxins. Low fiber diet, obviously, going to be a problem. So many times I see is that people who have been on antibiotics, they do not, restore after taking antibiotics. And so they never restore the probiotics. And really, it takes about 3 months when you're on antibiotics to even get back into a normal balance. So 3 months is a long time, and a lot of things can happen. So, patients who take antibiotics, no one ever restores their microbiome afterwards, and that's usually a huge problem. So GI disorders, they affect up to 70 million Americans. It costs a lot of money. I think every advertisement on TV is literally about something about your gut. I mean, it's either indigestion, diarrhea, something like that. So it's really costly. But, the issues are that people are just feeling all these symptoms. I'm feeling heartburn, I'm feeling abdominal pain, I'm tired. And then things keep going on, and they're just kind of masking the symptoms with a lot of times medications or controlling symptoms. And then it's leading to more things like irritable bowel and ulcerative colitis and things of that nature because they're not really addressing the problem. So I love to look at this gut barrier integrity. I love to show people this because what we're doing here is we're actually showing people the junctures. So, these are definitely your lining is your first defense, So if the border's open, the junctures are not tight, guess what? Toxins are entering, pathogens are coming through, food sensitivities because the food is coming through too large of particles. And so what happens is your body is not able to handle that. So when you understand this pattern, you understand like the protocol. So food sensitivities are going to be created because again, the body can't handle it. So you end up having a low systemic inflammatory condition where again, this immune system and this immune system fatigue starts to happen. So people get these autoimmune disorders and like, what's happening? I go back to the gut. I'm like, oh my goodness, well, you got to close the border. We got to help our immune system because you should be able to defend yourself against some of the things we talk about, the microbial toxins and the candida yeast, even parasites. You should be able to defend yourself. But guess what? The defenses are down because the immune system is fatigued. It's just too tired. So we really need to help our gut and barrier. So we need those tight junctions. You can even see those microvilli on the top there. They're like little fibers, almost like finger-like projections. I always talk about a towel, like a terry cloth towel. It's light and fluffy when you first get it, and then you wash it a couple times or a million times, and then all the fibers start to tamp down and get congested. So now we're not even talking about leaky gut, where there's spaces between the junctures. We're talking about the microvilli that are supposed to be like absorbing nutrients and taking in. If that's not good, you're not going to be able to have that digestion and absorption. So it's really critical to tighten the junctures, and it's really critical to get things free flowing. So all of that is important. And again, the damage can be revived. You just gotta, help yourself. So that whole, leaky gut is not a diagnosis, it's a mechanism. So this is what's happening. You can just see, toxins are leaking, things are going across the border. So, we have a lot of microbial toxins. So there's not just like toxins from the environment, things of that nature happen, by what we're eating. And this is sold on our GI. But then we end up like, it's like a trash can, you know, your trash is full. And all of a sudden, parasites come in and go, yes, this place is great. This is party town. I'm sticking around here and I'm inviting friends and we're gonna have families and extended families. So you've got this parasitic situation. The yeast is like, great. We've got people that love our parties, so we're gonna, get even bigger. So you end up having, a lot of issues as far as fatigue, brain fog, digestive distress, even that autoimmune. And this, it's why patients come in and they actually say, I feel toxic. They're literally saying, I need to cleanse. Give me something. They're just bringing it on themselves. I know exactly what I need here. But yeast, candida issues, this is a big problem. I mean, it's a problem too because of these biofilms, they're like protecting these yeast colonies. So a lot of times people are like, I'm staying away from sugar, or they'll say, I try, but I just don't have willpower. And I'm like, it doesn't have a lot to do with your willpower. It has a lot to do with the yeasty beasties inside of you telling you what to eat. And they're not happy unless you eat sugar. So you can be very agitated and stressed when you have yeast issues. And again, we can stay away from sugar and get into a controlled situation. But unless we attack those biofilms with some of these enzymes, we're not really going to get to the root of the problem. And that's what we're trying to do here is get to the root of gut health issues. And so yeast is one, or an overgrowth. So we have that balance, good bacteria and yeast. But what happens is yeast will grow when we eat sugar. When we're stressed, good bacteria goes down. The foods that we eat that have antibiotics, we take antibiotics, good bacteria goes down. So there's always this, forcing good bacteria down and yeast up to grow. So it really takes a little bit of more effort than just staying away from sugar. Um, so parasitic infections, things of that nature. I mean, I don't have all night to talk about parasites, but I'd love to because I spent a whole year talking about parasites with a medical doctor that her entire practice was parasites. So we toured the country talking for 8 hours just about parasites. So, I mean, I have only like 5 minutes to talk about parasites, but parasites have, they're pretty much everywhere. And most 80% of the population or more, I'll probably use 80% a lot tonight, but 80% of the population or more has parasites. And it had, it's really in fish, salmon, they talk about it being in every, piece of salmon, sushi, things of that nature. I love to give the analogy, do you like sushi? And people are like, yeah, that's great. I eat it all the time, which I'm like, okay, you have parasites. But I say, do you eat the wasabi and do you eat the ginger? And then they say, well, no, I don't like that. Well, I said it's not a condiment just to accent the fish. It really is the wasabi is to kill the parasite and ginger's to digest the parasite. So people in other countries, Asians, they know that this is a thing. They just take precautions. We're mindlessly eating them, half the time, we're not cooking everything, or sushi grade would be it's frozen in its complete form. So there's just a source of contamination that's all around us. So we don't have to necessarily travel. I mean, some people do travel and they get more parasites. Um, and if you have pets and your pets don't have pants, they're not wearing pants. So your pets are on your carpet, they're on your couch, and they're on your bed. Good for you if you don't have them on your couch or your bed, but shame on you because we love our pets and they have to be sleeping with us. Anyhow, but these are airborne and things of that nature. I had one individual that came to see me and she had parasites and the doctor had said, confirmed it, gave her something. She had lost all this weight. I said, did he find out where they came from? And she said, yeah, they came from kale. So obviously, that right there gives you an idea that they're pretty much everywhere. So I really feel like people should do some type of parasite cleanse, probably like twice a year on a regular basis, and really just be doing your best to get rid of parasites. It's not if you have parasites, it's what are you doing about your parasites. Um, so some of the indicators on the clinical side, certain markers, because they're really not, a physician's not going to say, oh, you have a parasite, unless it's a serious situation. But there are low-level infections that are going on and co-infections that are going on. So we look at the blood markers, obviously, the elevated eosinophils and the basophils. And so, that's why we take Dr. Tracy's course, and we can identify these things in the blood work that can be indicating that we do have parasites, because it's not usually often relevant. So maybe if someone's traveled, and things of that nature, there might be some tests, but standard tests don't really show this. You've got to look beyond the blood work, as the name is called. So what are we going to do about these, this assault on our GI and the different autoimmune disorders that come about, and the different GI issues that that are happening to us? An effective detox protocol involves these 4 steps, and this is the steps that I usually use. Removing pathogens, improving the digestion, repairing gut lining, and restoring microbes. So those are the 4 steps that I take. And really, you can't skip the steps. You got to break down the biofilm. If you want to get the results that you want, you've got to take the steps. And when they don't get results, people haven't completed the steps. So you really want to make sure. One of the things I want to say, even before you start removing pathogens, you may want to say, I want to boost my immune system a bit, because your immune system has failed you a bit. If you're inundated and you really haven't traveled and you haven't really eaten, you're just more susceptible. I remember as people get older, sometimes people are like, I can't even drink city water, because city water has, so many parts of cryptosporidium. And so you're still going to be susceptible even to the things that most people aren't. So you've really got to get your immune system going a little bit more, and also helping with adaptogens. So the stress and the immune system are probably 2 things that probably need to be improved, even if we do this detoxification, because you need your immune system to really get some momentum going, and sustain you. We get cancer cells 2 to 3 times a year. They're the size of a pencil. What's keeping it in check to our immune system? Are you creating the perfect storm here? So we are trying to help our immune system in every way that we can, because it is always fighting for us. And when it stops fighting, that's when things go wrong. And inflammation will cause a jam in the traffic jam, so to speak, and we won't have the health that we want, because inflammation is the cause of all illness. So removing pathogens, improving digestion, repairing the gut lining, restoring microbiome is going to be critical. So the first thing is to remove the pathogen. So again, got to work on your immune system a bit, because once we remove it, your immune system has got to take over and do its job at keeping us safe. Parasites, obviously, or pathogen. Candida or yeast is a pathogen, even though good bacteria and candida are, kind of our friends in moderation. I mean, good bacteria is great, yeast in moderation, we can work together, but too much is going to be not good. So harmful bacteria also is, the foreign invaders are going to get us. So we really need to do all we can. So the formulas we use are Candy Kill, we use Parakill, we use Microgon. So parasites definitely are linked to a lot of different symptoms people experience. So if they're fatigued, they have abdominal pain, nausea, diarrhea, MS. There's a lot of different causes or I guess root causes of the symptoms that people are experiencing. People would have anxiety, depression, definitely a parasitic situation can occur, and then even insomnia. Parasites can keep you up at night. So this is a little bit of a practitioner kind of protocol that I've used for parasites. Now, again, once we see different things occurring on blood work, we can kind of formulate the person probably needs a parasite cleanse. So, Parakill is used. We use that 4 capsules a day. We go into using Microgon. And Microgon is nice. It's kind of used as a binder because it's kind of killing off the um, microbes and things that are residual from the parasites being killed off with the parakill. I do like Remove Complete too because I just think that you can have an incredible amount of die-off, definitely with yeast and things of that nature. So and mycotoxins. They're just, you've got to kind of clear the slate, so to speak. Like you've got to remove some of the trash. And like, remember I said the trash can situation. So if you say, well, I'm just going to spray the trash can because it's got some bugs, and meanwhile there's maggots in the trash can, and the trash needs taken out, and there's just a lot more to the process than just like I'm just going to spray it and get rid of the bugs. So we use this parasite cleanse for the duration of 2 months because it's a little bit of a work, to do that. And then we use for the yeast fungal program, we also use that for about 2 to 4 months, and we use Candy Kill for that, and we use SBC. SBC is a probiotic that is used, Saccharomyces bulgari, and that's like very stable, but it also is very good at reducing the yeast in the system, so it can kind of stabilize things a lot better. And then we'll switch it into like a superbiotic. But we always want to help our liver and gallbladder too, because there's just a lot that's processed. And like, again, endotoxins or toxins from the parasites, from the yeast, a lot of die off. Your liver is meant to metabolize and get, and clear itself of all the toxins. And so the toxins are coming from environment, but they're also coming from the pathogens inside. Um, so we have a clinical study here that we kind of did, or actually had a male that came in. He was 55 and he was traveling. And so he, talked about being fatigued and having digestive irregularity and skin issues. I thought, okay, well, travel, red alert there. So he definitely had on his blood work, higher numbers on the blood count that would indicate that he had parasites. And there's all kinds of parasites, so a lot of times people are using different forms, but of products. Some people like ivermectin and things like that. But that's only for certain, like roundworms and things of that nature. So when you get into formulas like we have, like Parakill, I have my whole facility back here, like resources. But black walnut, the wormwood, these things. Party Arco, you could go down through every single one of those ingredients, garlic, things like, and they're going to be killing off certain parasites. So it's a very broad spectrum. You're able to address a lot of parasites that are found in the body. So, I definitely think the Parakill is really great. So again, seeing that blood work and removing the parasites is definitely going to get the body back to where it should be. So using the Parakill, the Microgon, the GI Complete, the Superbiotic, and the Live Complete, it would be very important. So obviously 4 to 6 weeks, his outcome was he had more energy, his skin was clear because he did have a rash, his digestion was normalized, and also his blood work was normalized also. So then we had, obviously issues with yeast or candida overgrowth. That can cause so many things. I mean, people, weight issues. There's way more than what I've listed here. Brain fog, sugar cravings, fatigue, things of that nature, but depression, anxiety, there's just a lot. And usually when I hand someone, we have those nice little brochures, the yeast fungus and the candida program, and it has like a little questionnaire at the top, let them look at that. And it tells you exactly what to take and exactly what to eat. Those are really great booklets to have, handouts to give to people. But the program's on there. The Candy Kill, the 4 capsules at breakfast, the SBC, again, 3 capsules at night. And then we do this for 2 to 4 months. Like once your symptoms have been relieved, you've kind of moved on to month 2, which would be the candy kill and the superbiotics, along with the lymphatic tincture. But when it definitely is, one of the biggest hidden drivers of chronic fatigue is this candida issue. So, when people say, I'm just so tired all the time, we really would want to do this program. Obviously, avoiding sugar, alcohol, refined carbohydrates, these are just feeding yeast. But again, it's not willpower, it's more so let's get you on the program, the cravings will go away. And that's what happened with this individual, 42. She had bloating, brain fog, sugar cravings, fatigue. She had a history of antibiotics, stress, processed diet. And then, obviously on her symptom score for Candida was high. Definitely she had GI distress and fatigue. And then her lab indicators obviously were showing some bacterial and fungal imbalances and inflammation present. So we used that, phase 1, we, got rid of some of the yeast fungus, and we'll get into phase 2 and digestion, and even phase 3 and repair with some of our products we use, GI Complete and IgG. We'll talk a little bit more about those. And then we also did rebuild with good bacteria. So we're killing off, we're helping break down, the enzymes, the inflammation. The enzymes are going to be great for inflammation and repairing that. GI Complete is so complete. I mean, it has the DLG in it, which is diglycerized licorice root, which is for H. pylori. It's got slippery elm, obviously going to be of demucilin soothing for inflammation. It's got the arachnogalactans, so obviously that's going to be immune system repair, regenerating L-glutamine, gluing back those junctures. That's what I say it always does. It glues back the junctures. And the IgG is for, is so good to just get rid of all these mycotoxins, mold, things of that nature. It's a great binder. And then the good bacteria. Good bacteria, I kind of end at, I add that at the end, not necessarily at the beginning. And the reason why is sometimes probiotics and, if they're prebiotic, things of that nature, they can kind of be food for, bad bacteria and even food for yeast. So I think that sometimes the ingredients can lead to that. So I kind of wait till things are clear to add that. But in the labs, this is the improvement. So the neutrophils, the lymphocytes, and the eosinophils. So you can see before and then after using the protocol, we can see a reduction in inflammation, and the immune system was balanced, and the parasite situation was resolved. And yeast fungus is a parasite. It can, it's going to be like that. So before had brain fog, now clear thinking. And then of course bloating. That's probably the biggest for individuals, especially women. They're just like, I want a flat abdomen. Why do I look pregnant? Like by 5 or 6 o'clock. There's a reason for that. You've got more things in your gut than you should. And then again, the cravings and the fatigue. So Nutritional Frontier just has such an array. I mean, I just love the quality of the products, the integrity. I love the efficacy. I love the safety. I love the formulas. I think they're very original. I think they're innovative. I think they're, really on the cutting edge of things. So I think they're spot on. We just have such a resource to be of these products, and just so happy to use them in my practice. So bacterial issues, these are related to Crohn's, colitis, and irritable bowel. So GI Complete, IgG, and superbiotics are used. And I think that these are just phenomenal. So again, that IgG, immunoglobulin, that's going to be able to go in there and, literally be that ultimate binder, drainer for all bacteria, molds and spores. And then we use the microgon, and then the GI Complete and superbiotics. I don't have a case study for this one written down, but I'm going to tell you about it. So this individual came to me, and she had like this chronic diarrhea situation. She was a medical individual, and she said, hey, I kind of did everything in the medical route. I mean, I'm in the medical field, so I tried it all. So I thought, why not give you a try? I'm like, great. Good for you. You should have came here first. So anyhow, she's like, I said, okay. So I gave her this protocol, and I mean, she was just beside herself. Like she was having diarrhea. It was constant. And it wasn't but 3 or 4 days. And she called me and she said, are you kidding me? I mean, literally, I feel like I am completely healed. I'm like, well, let's give it some time. But she was just amazed because again, she had been to the medical route and she had tried everything. And she's just said, this is like a miracle. Like it's a miracle, and sometimes you feel like a miracle worker, but you got to take that aside because you're not a miracle worker. You're just like, these things really work. You're a person that's willing to take on and become the CSI of health and figure it out for a person and give them what they need. And it works. And she was so thankful. And really, it was years. Like she would be sending people to me. I knew exactly who sent them. I knew that she was the person, and she just sang the praises. She's like, "You've got to go see this individual." So I love that, to help someone like that because I know they're going to be really out there helping other people also. And so, it's really amazing to help people to get to the bottom of their health concerns. So, the microbiome disruption with bacterial issues is a real situation. And so we really, using this protocol is amazing. So digestive support, is definitely a phase two. So you want to kill off, but you also want to use that digestive support because you can't heal what you can't digest. So, enzymes are foundational. I mean, they're the catalyst that make things happen. I mean, the betazyme, which has hydrochloric acid, your stomach needs to be, pretty acidic. As you grow older, you have less hydrochloric acid, you have less enzymes. As you get older, betazyme, I think, is needed more and more. It also, people who have acid reflux and things of that nature. I mean, do you have too much acid or is it too little? Most likely it's too little. I mean, believe it or not, we could have a whole class on that, but that's for another time. But it really is the need because 2.0 acidity is what your stomach should be, and that means it will burn a hole through the carpet, through the floor. I mean, it has a purpose to prevent bacteria, to prevent parasites, to break down your calcium, to explode your food so that it's easier to digest through your digestive system. So Betazyme, I think, is really one that I use occasionally, especially during heavier times of holiday and things of that nature. But Prozyme is a nice chewable that people will use, especially for kids, and people don't always want to take capsules. But the Prozyme has enzyme and probiotics. Same thing with Cybezyme, probiotics and enzymes. So, having digestive support is really important because we're eating box packaged food. We're eating things that don't have enzymes. And so if you don't have enzymes, you're not going to break down your food. So a Twinkie lasts, 100 years on the shelf. It takes a lot of enzyme action to break that down. If the earth and bacteria doesn't want anything to do with it, who's to say that your bacteria has any chance of breaking it down? So you end up having, utilizing and using so much of your digestive enzymes. So again, you've got to turn your food into good food, obviously. So, digestive support is really important. So, if you have bloating, undigested food, gas, something like that, I mean, know that bloating is poor enzyme function. Obviously, things are fermenting in there. I mean, you're just blowing up. Undigested food coming out means that you didn't have enough enzymes to break it down. And then, if you have a lot of gas and digestive discomfort, you probably have low stomach acid. So again, gas would be a signal that, parasites or bacteria have come in. So I do think that digestive support is really important. So we really do, you want to kill off, obviously there's damage done, from the parasites and the bacteria. The enzymes are going to help keep the area clear and break it down, but also you want to repair the gut. So repairing is really important. So if the lining's not repaired, the symptoms return. So again, what's the terrain in your body look like? I mean, if it's not good, and the borders are open, then you're going to end up having just more problems, autoimmune disorders, bacteria, things of that nature coming into play. So we use things to restore the intestinal barrier. So GI Complete and IgG are two of my favorites. I mean, I don't even have enough of them. I mean, I have like one more of this on the shelf. I can't wait till it gets in. And I think I have one IgG. I mean, I have to say, and I know it's their top seller. It's my top seller. So because it just helps so many people. Um, so phase four is the microbiome restoration. So again, we're kind of restoring the levels of good bacteria or fish in our fish tank, So we went the sub layer and then we went the high test layer. Sometimes I always tell people they have gut issues and they're like, yeah, but I take this probiotic and I think, it's pretty good. It's refrigerated. And I go, oh, great. So you have a leaking of your fish tank, the filter doesn't work, you've got algae growth, and you decided to put in tropical fish in your fish tank. Good for you. You know what? They're never going to make it. They're never going to make it. So you have to restore your gut to be able to have the proper microbiome and the ecosystem that you want. So we have to reintroduce the beneficial bacteria after things have really gotten in a better situation. So they're essential for that long-term stability too. So this was an antibiotic-induced dysbiosis. So, this was a pretty young individual, 29. She recently had used antibiotics. She had a lot of symptoms, bloating, fatigue, irregular bowels, a lot of times they'll come and they have uh, diarrhea and things of that nature. And that's a giveaway there. So, in this case, the rebuilding definitely would have to come first, not last. I mean, she just doesn't have enough. And I think, the other thing is like the appendix. So I remember way back when, I'm going off subject a little bit, but the appendix is where you store the bacteria, good bacteria. And like whenever you have like flus or things like that, and you have like a sudden rush, everything leaves the body. That appendix is able to repopulate your good bacteria in your gut. So the appendix is probably another thing. If you don't have your appendix, you don't have that resource. So that's even more important as to why you need to take probiotics. So restoring for her, I love the SBC if someone's taken an antibiotic first. I mean, superbiotics is a lot of times also, but if they have diarrhea associated with it, loose bowels, I would definitely be using SBC. Superbiotics are super, so they're highly concentrated. But then using enzymes and GI Complete because, she kind of got her rug pulled out from underneath her. 29 is pretty young, pretty healthy, but just needed to have this kind of reset done. So, we have these resources. Obviously, the Cybezyme, Probezyme, all these different enzymes and probiotics, and the newest one, the ProBio 3. Mikey G just talked about that the other day with us. And of course, my husband, Bill Branch, decided, oh, I'm going to take that product. I don't know. It's been under a week. He's already lost 2 pounds. I'm like, just GLP-1 booster is really working for him. So, um, your gut health and gut integrity is just so important. And the probiotics that are available in this new one, the pre-post and probiotic is just amazing. So we're pretty toxic. We're pretty toxic individuals. America, toxic in many ways. Again, the glyphosates, they're found in pretty much all the box package, wheat, corn, soy, um, you know, artificial flavors, all these things are super, makes us super toxic. So we really have to make sure our detoxification pathways are open. So a lot of times, we say, oh, we should be eating healthy food, lean protein and vegetables. People are usually not getting it. And so I'll resort to different things, definitely the proline greens and the chlorella and the ultimate shake and the live complete are just ways to make it easy for someone to have all they need to help the body to detoxify. So the toxin list is long, and so we want to help our detoxification pathways too. So we always want to support our liver with Live Complete or liver gallbladder tincture. There's just different resources there that we can help ourselves. So we're always dealing with those toxins and the toxic loads, our liver, our colon, our kidneys, and our skin, constantly excreting. So you just want to really help the body as much as possible. So the diet for gut healing is definitely avoiding sugar and refined carbs and processed foods, obviously. You can't eat perfectly, but your gut is compromised. If it's compromised, you really can't heal. So I kind of go on to the thing where, lean protein and vegetables, but I love soups. I think that, get some bone broth, throw everything in there, and, it's a pre-digested process. Roasting, steaming, those kind of things is great. But it's pretty simple, that lean protein and vegetables. But again, it's easy to get off of that and get into the situation where you're more likely to be feeding bad bacteria in our gut. So I do like a lot of our, uh, nutritional support. Our metabolic clearing at Ultimate Shake is amazing. I love the Ultimate Shake Plus, which you have that packet now that has the Ultimate Shake along with the proline greens. That's super convenient. I used it on my trip recently, and I thought this is great, tastes great, and I'm helping myself while I'm away because that's when you get most of the inflammation when you're eating not the right food. So all of these are really, really great, but I do like to support the body as much as possible when we're going into cleansing because if you don't have what you need, you're not necessarily going to be able to detoxify, not have the strength to detoxify. So remember that parasite cleanse. Again, I kind of use it like myself twice a year. I mean, the duration is 2 months there, and a lot of people say, okay, during the full moon, you gotta get rid of the parasites. That's when babies are all being born, and that's when parasites are. But there's a life cycle to parasites. There's and if you kill off all the parasites and you don't give them a chance to be born, they kind of get in this cyst-like situation and protection. And so you really want to kind of keep that process going so that you're killing as the life cycle is being, you know, it's performing all that they need. So it'll be adult stage and lower stage and all that. So you want to go through all the stages with that. Um, this is a lot of times, this is kind of my 30-day gut reset protocol that I'll use probably twice a year. So I like to use that parasite killing product or Parakill. And I love the Betazyme because the Betazyme is definitely the hydrochloric acid that's going to, help along with the enzymes to make my meals the best they possibly can, breaking things down. I like to use the GI Complete to really heal my gut, close the junctures. I'm thinking probably I've had some glyphosates, don't know. Superbiotics, definitely like to use those in more concentrated form when I'm doing the reset, but I like to just incorporate like the Frontier Biotics on a regular basis. Live Complete or something for my liver is always happening. I mean, I am always like, we need to help our liver. 561 functions of the liver. Let me tell you, there's not enough you can do there to really make sure that it's performing all the functions that it should. And there's just so much, and that's obviously not for tonight, but let's talk a little bit about the lifestyle foundations for detoxification. We talk about probably in the beginning, it's probably like, oh, you need to, think right, sleep right, all those things that we always talk about. But it's really important to have proper, stress reduction, proper breathing, lymphatic movement. You've got to get out there. You've got to get this lymphatic system moving. You've got to get fiber in your diet. You've got to get hydration and definitely helping your sleep. If you don't have a good, outlook or just even, your stress level, the stinking thinking, I think we call it, if you have that going on, it really is not conducive for healing. Like you really need to be in the right mindset. Parasites can make you think a little crazy, or also bacteria and things of that nature, because your gut's being affected. Your gut is your second brain. So, we really want to help the gut as much as possible, because again, that's what's forming a lot of our thinking. We think top down, maybe our brain, we're thinking the thoughts we shouldn't be thinking, which we need to redirect those. But also from the bottom up, our intestinal system is influencing, the more negative, the serotonin's not there. We don't have the proper neurotransmitters to feel happy go lucky. So we really want to help, obviously this thinking and redirect what we're doing, let's be kind to ourselves. And, obviously having that close relationship to God is really important. And then we're just inundated with toxins. So, the infrared sauna is phenomenal for getting rid of heavy metals. There you have co-infections, then you have just contamination. It kind of goes hand in hand. So, the infrared saunas are great for stress, and they're great for, that detoxification. And then the red light therapy to get that ATP going, your mitochondria. I mean, really, we need some action. We need, cells being able to respond to the problem. I like the power plate or some kind of vibrational plate because that's obviously going to get your lymphatic system moving. And then I'm actually using some molecular hydrogen inhalation, which is great, to really help with the detoxification. It's very selective at its oxidative stress and relieving it. So there's a lot of things out there. But again, if you can just get out there and get in the sunshine, you're probably going to do quite well, because the sunshine is like red light. We just kind of use red light, in a way that, hey, it's just convenient for us. It does do a great job. But again, everybody's not able to spend all day outside. And we're on, lighting that's not conducive for health. And our cells are just like a plant, it's just like not getting the right energy. So we need some red light. I mean, to combat our lifestyle that we have right now. So there are these different services that can be used, but know that nature is probably our number one, resource. Eating healthy, clean foods along with having the inputs, the outside and nature, they can definitely, it's definitely a better way to go. So, if you're looking at like, well, how do I assess everything? There's GI symptom questionnaires, the blood markers, there's digestive history, and you can kind of like a little clinical decision tree I have here, gas, bloating, digestive enzyme support, sugar cravings, fatigue, yeast issues, GI distress, traveling, parasites. I mean, we're trying to let people obviously, indicate to us what is actually happening. And then we go further and say, okay, blood work, we go further. Okay, the Zyto. There's different ways. And then the questionnaires, I think, are phenomenal. So you're just, trying to get to the bottom of the health concerns. So long-term gut maintenance is definitely, taking something like an enzyme probiotic. I love the Cyzyme. I think that's great. I mean, 2 for 1, right? Enzymes and probiotics, you can't go wrong. So, the case studies that we showed, obviously, different protocols for yeast, fungus, things of that nature, and the parasite cleansing. I mean, they're all just going to be super important. So, we just see a lot of times gut microbiome is out of balance. Dysbiosis is common. We have yeast, fungus kind of coexisting with parasites. We have antibiotic trigger imbalances, and gut repair is just essential. So this is just a quote someone had given me. I had constant bloating and brain fog for years, and after following the protocol, my digestion is normal, my energy is back, and I finally feel clear again. I mean, that's obviously why we're doing this, is because we're and everybody's in search of this. It's trying to alleviate human suffering. And this is great. I mean, this is why we do this work. This is a great testimony from somebody who has done the program, has done it completely, saw it through the 2 to 4 months. I mean, it seems like it's a long time. And there's steps involved, but we need to follow through. We need to do the steps. We need to get our gut in order, and then we need to keep it in order. So as a naturopath, we're teaching people how to take care of themselves, rather than waiting for a crisis to occur. So, it works because we're, again, removing pathogens, restoring digestion, repairing the gut lining, rebuilding the microbiome, you know, and the takeaways are, the gut health depends on, your lifestyle, your ability to detoxify, your digestion and optimizing it, and then the microbial balance. So, if anyone struggling or is, fatigued or brain fog, digestive issues, that's like everybody. Like raise your hand. No, everybody. The good news is it can be corrected. So, just addressing that gut dysfunction, really is going to be, it's a little bit of a process, but you'll get through it and you'll be all the better for it. So I appreciate and thank you for attending. And there's my contact information.
Very awesome. Thank you so much. See why she's amazing and has been doing this for 30 years because the girl gets results.
Okay.
So that was great. Thank you so much.
Okay.
There's a few questions to address.
Okay.
Um, on your whole parasite dog sleeping in your bed thing, I was like, man, I
Oh,
feel
I
so,
know.
like, do you
Your
have
dogs don't
cameras
wear
in my
pants.
room or what?
My next business is I'm just going to make pants for pets.
That'd be great. Like little parasite sticky pads right on the butt. All right. What is your alternative for IgG if the client has severe hypersensitivity to beef? I use KBMO test to minimize false positive results as they both test IgG and complement activation reactions. Beef came up at the highest category.
Hmm. That's pretty unique. Have you come into with that,
Yeah.
Tracy?
My first question would be, Carrie, is if this guy had Lyme and particularly bitten by the Lone Star tick,
Yeah,
because
yeah,
this
yeah.
sounds a little bit like alpha gal, where they're getting
Hmm.
histamine responses from beef. That would be my first thing. So, very common tick in Pennsylvania, our area. There's a lot of alpha gal
Hmm.
that results, and basically it's a mast cell activation that it can trigger, when they take in beef now because of high alpha gal IgE. So you could actually test that on blood work, alpha gal IgE, and see if they have it. Um, I know IgG immunoglobulin is awesome, and I guess you're trying to bring down inflammation or maybe clear out the gut. I would probably use Remove Complete. And then you want to use something that lowers histamine response like DAO. You could also look at Air Max that has some Borrelia seed and it might help systemically. But what I've seen for histamine response and whatnot would be DAO. Make sure you're looking at liver, as Dr. Brenda was saying. Sometimes too many ingredients in a formula for these type of people that might have, I'm not saying he has alpha gal, but if he does or you have a histamine reaction, you get too many things in one formula and you start to have an issue. I would start with something easy like Nattokin Plus and do it on an empty stomach, just to bring down that systemic inflammation and the histamine. And then you can bring in other things one at a time. You also want to look at raising his hydrochloric acid. So Betazyme would be great because he's going to need a lot of bile support. But definitely ask him if he ever had Lyme. And I would definitely test for alpha gal IgE blood test. You can have that drawn and see if that comes up positive. If it does, you probably have a bigger issue than just being beef sensitive. You have a Lyme issue now. So, any other questions? It was super thorough and comprehensive, so I loved it. And I do think the cleansing twice a year is really important. You know what I mean? Especially if you have animals or, if you do partake in sushi, and I do all those things. So I do keep Microgon and Candy Kill and Parakill on hand. And I like to combine the Candy Kill once in a while, just like maybe once a week, do one day of the Candy Kill with the
Yeah.
Parasite Cleanse, just because of the garlic and thyme and all the antiviral, antimicrobial, bacterial
Yeah, I
parts.
think you just know after you've done it, you know what you need when you need it. Like you'll
Yeah.
have a bottle on hand. Like I always have a bottle of Candy Kill on hand. I'm like, so yeah.
Yeah, the what if Candy Kill makes these symptoms worse? I would say that's leaky gut, lipid polysaccharides from the endotoxins of the candy kill.
Mhm.
So I would totally do systemic enzyme therapy, um, Nattican in between to eat up any of that stuff in the blood and remove complete. The remove complete is a binder and it's going to be a purifier plus restore some minerals. So make sure you're taking that 45 minutes away from everything else. I usually tell people to take it before bed. I don't know if you have some thoughts of that.
Yeah, that's the same way I usually say before bed. But yeah, a lot of times people are just taking one part, like again, without a binder, you can really, I mean, back in the day, we would do different things to, for parasites and they're like, oh, you're sick. Well, that's great. You could just, it's coming out. But really, we realized that, oh, we probably needed to add different things. And as I was going on, I would always be like, okay, I need to help the liver. I need help methylation.
Hmm.
I need to make sure that you're able to, remove completely. And it might have been fiber at the time, and, rather than a binder, but we were able to kind of absorb some of the excess because really when parasites or even yeast is dying, they're just kind of, spewing out all the toxins, endotoxins. And so all these things are, making people sick, so yeah.
Yeah. And you also have to look at sometimes when people have high yeast, they're going to have motility issues, they're going to have digestive enzyme issues. That's why she's saying you got to do this full phase. And it's
Mhm.
okay to not be like cleanse first, support second. You can intermix it and intertwine depending on what you're seeing. So with the
Mhm.
person that, when he's taking candy kill, I would say the die off is too quick. So one, back it way down to start with one pill a day, right? Or go in with probiotic support first.
Mhm.
That way, you're kind of building the good soldiers that are going to help fight the battle. You could start with SBC and superbiotics, or even just frontier biotics if you wanted to be more gentle, and then do a systemic enzyme protocol and then digestive support enzyme protocol at the same time. That way,
Mhm.
you're kind of enhancing the motility of the gut, you're activating the pancreas, you're eating up things in the bloodstream, things that are dying off and coming out through the leaky gut. The GI complete would be great on that because it's going to help heal and seal. The glutamine's going to feed that.
Mhm.
Biofilm support, I'm not quite clear on that question. If you can clarify that. And Carrie, this guy, history of brain concussion, liver is a mess. Yeah, I would just see, I mean, if this kid is an outdoors kid. But as we know, if you have leaky brain, you have leaky gut, because as Dr. Brenda was talking about tight junctions of the brain, and, anytime that that epithelial tissue is damaged and leaking, which is what your blood-brain barrier is made from, it's what your intestinal tract is made from, is epithelial tissue. The great thing about it is you can see regeneration within 3 days. So just by utilizing some products, sometimes we go for the detox very quickly and people don't have the elimination pathways open. Like you're saying, his liver's congested. So yeah, if you're going to put something that's going to cause a die-off, he might not be able to get it out. Is he constipated? Are we having normal bowel movements? Like Dr. Brenda was saying, what about fiber? It's all the little things. So we can give you these protocols and be like, hey, here's how we do it. And it works probably 98% of the time. But you always have these one-off people that throw a monkey wrench into our protocols. So make sure that you do adjust and make it
The
easy
one that
for
said about a
them.
concussion,
Mm.
I know that the ProBio 3, that was one of the things Mikey G talked about specifically about concussions and how it could actually help individuals by taking that particular product. So
Yeah. Yeah.
the gut health, yeah.
Yeah. Okay. So now I understand her question. She said Candida can create biofilm. So do we need that support? Absolutely. So, what a biofilm really is more of a glucose wrapping around a bacteria, yeast, fungus, virus. So what happens, it's this slime layer, right, that builds up around the Candida and it kind of shields it from the immune system because your immune system's like, what is that slimy, sugary coating? It looks like insulin. So what does, or it looks like glucose. What does your body do with glucose? It shoves it into cells. So that's really what happens, and that's how it can kind of spread. So you get your polysaccharides, which are like your sticky matrix. You get your DNA fragments, your proteins on that biofilm, and it even can have minerals, and there can be metals bound in there. So when you break a biofilm, you can get to the candida inside, but you have to remember you're causing a lot of systemic inflammation outside because you just broke apart this slimy, maybe metal contaminant. That's why they tell you that heavy metals coincide with candida because the biofilm can contain metals as part of their binding. So candida can be super resistant, so it would be very beneficial to try to have your person do a heavier dose of the Natacin Plus. If they can't do it on an empty stomach like multiple times a day, what I tell people is take 4 or 5 capsules at a time, break them open, throw them in water, and down it on an empty stomach in the morning. Wait 30 minutes, then you can go eat and do everything, and then do that again at night. That way, you're getting like a mega dose and it goes in quick. And you're not swallowing a bunch of pills because not everybody loves that. But systemic enzymes, elimination pathways, and then you can try very gently the candida. It does sound to me, though, because he's reacting so highly to the candy kill, which has like oregano and thyme and garlic in it, that if it's an alpha gal, he has an oxalate issue as well. So I'd ask him if he has kidney stones or ever has stuff like that. So my brain's going a million miles a minute, but if someone has their gallbladder removed, would you offer liver gallbladder tincture to be enough? What do you think, Brenda?
Um, looking at the what's happening, I think after about a year and a half, your liver or your body forms like another little pouch, so you're trying to get him into the transition. How long's it been? Has it been a year and a half? How long the duration? So they may need help with the digestive enzymes for
Yeah.
that. Um, along with the liver gallbladder uh formula. Um, so, I mean, it definitely, it's a timing situation. I mean, obviously the betazyme and things like that, it's going to be a little bit better with ox bile, to help them. It's just a steady drip, you have too much or do you have too little? Most of the time it's too little now, breaking it down. So,
Yeah, the betazyme for sure, because it has the ox bile, it has the betaine hydrochloride, which will promote, because that was their issue in the beginning. Their
mm,
issue in the beginning was they were low hydrochloric acid. They weren't producing enough and they weren't activating enzymes. The proper
mhm,
enzymes at the proper time probably had the standard American diet. So they had congestion in the release of the bile that alkalizes the food that comes from the stomach. So their issue at the top was always hydrochloric acid. So the support liver gallbladder tincture is great because the liver is what the issue was. The gallbladder was just a catcher. Poor little guy, he's the one who gets ripped out and misplaced. The liver hangs around as like, ha, that was really me. So support the liver, look at Live Complete, look at Live Clear, 1, 2, and then Betazyme as well as that liver gallbladder tincture if you have. You will get that little tiny pouch after a while. It's not exactly the same, but it does okay for, trying to alkali the body.
mhm.
All right, y'all. I like the chatty question groups. That's great.
How do you love it?
Yeah. So thanks for joining us
Have
here.
fun.
Don't forget, next month we are back again. You can always catch us here on the third Wednesday at 6 p.m. Eastern Standard Time for our webinars. Next month, we're bringing in Dr. Lisa Kellerman, and she's going to be talking about allergies. A is for allergies, complex allergies, and simple solutions. She is an expert in that. Dr. Brenda, thank you so much. I can't wait to see you in
Thank
April.
you.
You better be coming.
Yes. Oh, I'm
Okay.
coming.
All right. Because I'm
Oh,
going to
yeah.
stop pick you up. I know where you live. So,
You
all
bet.
right. How long
I'm
should they be
coming.
taking IgG? As long as they need it. And you can rotate
Mhm.
on and off. All right. There's no time frame on healing. Thank you,
No.
guys. Thank you, Dr. Brenda. See you next
All
time.
right. Thanks so much.
Bye.
Bye.